Yeah, hi, Lauren, Steve. This latest dispute between UNC Health and UnitedHealthcare could impact hundreds of thousands of patients if the two sides don't reach an agreement by April 1st. And much like the stand-up between WakeMed and Cigna that we reported on yesterday, those UnitedHealthcare members could suddenly find themselves out of network, and that could mean a sharp spike in their out-of-pocket costs.
Be a good partner. Help us, recover, be part of the solution.
Steve Lawler's a former health system CEO who has sat at the negotiating table with insurance companies. Now the head of the North Carolina Healthcare Association, Steve says the impact contract disputes have on patients caught in the middle is concerning.
If somebody has an OBGYN that they've been going to for prenatal care and all of a sudden they're out of network, that definitely creates a level of concern and stress during a situation that's already stressful.
Part of that stress comes from families forced to make difficult decisions when agreements can't be reached, stay in network and keep costs down, or pay more to stay with the doctor they know and trust. Eyewitness News obtained this letter recently sent by UNC Health to UnitedHealthcare members, warning of the impacts and the added costs they could see. Patient advocate Rachel Vaughters knows what that can mean.
Let's say you have a terminal diagnosis and you want to stay with that doctor, but they are no longer under the provider list. This can be absolutely detrimental to a patient.
UnitedHealthcare telling Eyewitness News that UNC's current stance would mean $570 million in added healthcare costs over the life of their 3-year contract. They said, quote, "Our top priority is utilizing the time remaining on our contract to reach an agreement that ensures uninterrupted access to care that is affordable. We will remain at the negotiating table as long as it takes to reach an agreement." Despite the current impasse, Lawler still has hope both sides can find common ground for the good of the folks who could find themselves in limbo.
When it's all said and done, if we can get to that point of shared incentives and a commitment to be part of the solution, these things can be worked through.
And with both WakeMed and UNC Health both confirming that they are engaged in these current disputes, we also reached out to Duke Health to see if they're dealing with a similar situation with any of the insurance companies that they work with. Obviously, we'll update our viewers as we hear back from them. Again, to be clear, the deadlines for WakeMed and Cigna, January 1st, and the deadline for UNC Health and UnitedHealthcare on April 1st. We're live in Raleigh. Sean Coffey, ABC 11, Eyewitness News.